Welcome to PFT Tutor with Jeffrey Haynes. Please click the like, subscribe, and notification buttons. It's greatly appreciated. This video is a quick case report of a patient with asthma who developed exercise-induced dyspnea despite escalating asthma therapy. This patient first came to our lab as a 9-year-old complaining of dyspnea during soccer. We performed a methacholine challenge and only took a single dose of methacholine to cause a 21% decline in FEV1. This response is highly suggestive of asthma, and she was treated accordingly. If you're interested in more information about methacholine challenge testing, there's a video all about it on my YouTube channel. 4 years later, she returned to be reevaluated because her dyspnea on exertion during soccer had returned, and despite a whole bunch of inhalers, the symptoms were so bad that she had to quit soccer altogether. Her spirometry was repeated, and it was quite normal, well above average for her demographics. Because her spirometry was normal, she was told that her symptoms were due to anxiety. And that's often our fallback diagnosis. If we don't know what's wrong with you, we can always blame anxiety. You might be interested to know that not so long ago, asthma was thought to be primarily a psychiatric disorder. In fact, it was referred to as asthma nervosa. Here's a couple of quotes from experts at the time. Salter said, "Asthma is essentially, and with perhaps the exception of a single class of cases, exclusively a nervous disorder." And also said asthma is a neurotic affection. The patient's allergist wasn't buying the anxiety theory and referred her back to us for an exercise laryngoscopy test. Exercise laryngoscopy is a way to detect inducible laryngeal obstruction, commonly referred to as vocal cord dysfunction. To perform an exercise laryngoscopy, an ENT scope is passed through a nasal passage, and you position it so the larynx can be visualized. As shown here, headgear can be used to keep the scope in place. Then you have the patient exercise on either a treadmill or a cycle ergometer for about 15 minutes. A video is recorded during exercise, and there is a scoring system for laryngeal motion. However, it's pretty obvious when a vocal cord adduction occurs. The clip we're going to see is at about the 9-minute mark of exercise. So we've been escalating the amount of watts she's had to work. And at this point, she's cycling really hard, breathing really heavy, and you will see the vocal cords start to adduct. You can see it right now. So it's obvious why she's having so much trouble during soccer. There was stridor present. And from this test, she was diagnosed with inducible laryngeal obstruction, and she was sent to a speech pathologist. And on follow-up, she reported to us that she was able to return to playing soccer. So a very good outcome. It's important to understand that inducible laryngeal obstruction may coexist with asthma. In fact, there's evidence that bronchoconstriction may cause laryngeal obstruction. Don't assume that every asthmatic only has asthma. There can be other causes. Patients can certainly have more than one thing wrong with them. And don't assume that patients who have inducible laryngeal obstruction don't have asthma. Thank you for watching PFT Tutor with Jeffrey Haynes. Please click the like, subscribe, and notification buttons, and we'll see you next time.